All right, today I'm going to talk to you about how to do a bootstrap squat. Most often if I have you doing this, I'm going to want you to be working on where you're shifting your weight in your squat, whether it's to the right or left, or whether it's forward or backward in the squat. I'm also going to have you work on your trunk position to make sure you're upright and not just collapsing all the way forward. And I'm also going to be having you work on your actual hip mobility. We want these hips to get nice and loose so you can drop down and your back doesn't have to compensate one way or the other. So what we'll do is we'll start in a standing position, which you won't be able to see me very well in, but we're going to end up straightening our legs and pushing back straight through our hips. I want those hips coming back so much with your knees straight that you get to where you start to lose your balance. At that point is when your knees should break and you should start to bend. So I'll start walking you through that part now. All right, we're in a moderate stance here. Our bootstraps are attached to our toes in this. You're gonna bend over, my knees are straight, my glutes are coming straight back, still kind of looking out towards you, but neck is in a neutral spine. Grabbing my toes here, we're gonna push those hips out and drop down straight into our squat. Knees are pushed out, back as erect as you can, and then hands come straight out. So right here, you should be able to maintain this. Now, you may not be this flexible, and you may be up here to do your bootstrap squat. What the bootstrap does is allow you to get down to your lowest point and learn where your weight shift is forward, backward, side to side. Now, if you do this in front of a mirror, you'll be able to see, am I rotated, am I shifted, are my toes coming up, or my heels coming up? So I want you to try this in front of a mirror so you can find out exactly where those compensation points are. Once you find them, try to tweak them a little bit one way or the other. So we'll kind of go back through that again. Moderate stance, the more narrow it is, the more difficult. Coming straight down, glutes are pushed back, push those hips out, knees out, my arches are elevated, they're not collapsed inward, keep them there, chest up and hands are here. So now that you're in this position, try pushing down further, but the back stays erect to get a good stretch between those hips. Lean to one side, stretch that hip, lean to this side, stretch that hip. That's not technically a bootstrap squat, that's just bonus for therapy. So we'll come into here. If you want to reverse the whole thing, get a good hip stretch. Keep those knees out, don't get lazy like I'm tending to. Toes are grabbed, push those hips back, and you come straight back up. Now that is your bootstrap squat for therapy. Good job.